It's great to be back here, and I salute Kāwis Nōkau on this fantastic program. That was a really neat DVD from Denise and the staff, and what you were doing here is actually a beacon of light for the whole country, for our whole health system. So I really commend you on that. That first slide there is actually just picking up Denise's point about hearing from patients and families and their stories. And at HDC, where as Commissioner I spent 10 years sometimes hearing about all the things that went wrong, the Advocacy Service went out and advertised in local newspapers for all the things that go right. And of course, patients have so much to say about the great care that gets delivered day in, day out, but also they're very good at telling us, you know, what were the elements of that. So we can come back to that. I just want to mention very briefly my special friend Andrew Pollen. It's a year today since Andrew died of melanoma, and I left here a year and 1 week ago from the Harry Ray's Grand Run to go to Mercy Hospice Auckland, where Andrew had just been admitted. And he had some very difficult acute admissions to some of our public hospitals. And to see the different way, the way in which hospice gets that so right, it's a whole philosophy about the way the family is included in everything, and yet they still do that in a way that Andrew, even as he was starting to float out of consciousness, he was still the first point that the staff would check in with Andrew when they came into the room. So I remember my mate today. And I remember also all the inquiries that I had to undertake. This was the jokes in the top right. This is from Whaanau DHB. Things have improved there too in the last few years. But of course you can get a very jaundiced view as a commissioner hearing about the problems. And we know, and one of the reasons why we've seen this movement in this country about compassion, about caring, is a sense that we've got to have another think about how we're delivering care, because in our complex health system something's been lost, and I think this has touched a chord with staff, and it's certainly touching a chord with the community, with patients, and with families. And just finally, I put up the famous painting by Sir Luke Fildes of the Doctor, 1891, hangs in the Tate Gallery. And of course, on the one hand, we see the patient at the centre, but notice how we see really the doctor in the centre, and the family, the parents, are barely visible in the background. I think part of what this week and this program is about bringing the patients and whānau into the foreground. So that's my little intro. It's now my great pleasure to hear our first patient story, your former CEO, David Clark.